WHO feels that by 2030, 1.1 billion youngsters will be affected by hearing loss because they are using continuously the headphones and musics and all. So audiologists and speech language pathologists who help people having voice, speech, hearing problems where medical treatment is not available. Children having they are born and they need to be screened for hearing. So the audiologist does the test called autoacoustic emissions (OE) test that helps to find out that the child has a normal hearing or not. Speech pathology, it says that breathing and speaking should go simultaneously. So if that is affected, continuously the child has a difficulty to talk, the fluency gets affected. And through Josh Foundation, we have helped more than 1,800 underprivileged children. And today, 25% of the children we have mainstream in the normal education.
Those who are hearing us, listening to us, this is going to make a lot of change. Namaskaram. Devangi ji, what's the role of an audiologist, speech therapist?
So audiologists and speech language pathologists are the people who help people having voice, speech, hearing problems where medical treatment is not available. Say like patient like paralytic who needs a speech therapy to regain their speech, hearing disability, like we help them for the hearing aids, we do the rehabilitation for them. Even children having mental retardation, spasticity, and all those people who have normal speech problems where medical treatment is not available. That's where the audiologist and speech language pathologist comes in picture. Apart from that, any hearing diagnostics like to find out the tinnitus, find out the vertigo issues, find out how much hearing disability one has, the tinnitus management, all the kinds of hearing diagnostics. Apart from that, children having they are born and they need to be screened for hearing. So the audiologist does the test called autoacoustic emissions (OE) test, and that helps to find out that the child has a normal hearing or not. So like that, any normal people having speech, hearing, voice problems, and also the speech people with disability having a hearing, speech, and voice problem. That's where the audiologist and speech language pathologist comes in problems
Giving the solutions.
Gives the solutions. And apart from that, we also work on voice therapy where professionals, voice users like you, artists, singers, they need a voice maintenance apart from medical treatment. That's where also we help them.
So two things I'll ask you. One is the word you said,
Tinnitus management.
Tinnitus management. What is that?
So basically, when you have a ringing sound in the ear, and you get irritation because of that, and if the medical treatment is not possible, that's where we have a called tinnitus management software, where we find out what exactly kind of tinnitus you have, and finding out that we create a QR code of some sound. So whenever you feel irritation, you can use that sound to minimize your tinnitus. Apart from that, in hearing aid also, like two of the companies have a tinnitus management software which can be installed in the hearing aid. So it's like a Zen sound. It's like another musical sound which suppresses your tinnitus. So that kind of fitting in the hearing aid is done by audiologist.
So when you say tinnitus, right? If I'm pronouncing it right, this can happen at any age?
Yes, it can happen to any age.
So why does it happen? You mean the ringing sound is something probably happens when you're on an aircraft?
So how you get a viral infection in other parts of the body, the same way the viral infection takes place in the cochlea, where the hair cells are little damaged because of viral infection, and that's where it gives a ringing sound.
Okay.
So ringing sound can be suppressed with the medicine, but many of the cases it is not possible to suppress. That's where this other therapy works.
Okay. The second question from what you said earlier is people like voice artists, singers, how do they benefit from what you do?
So basically, I work with doctor speech software, where we have a voice software where we analyze individual's voice.
Okay.
And then, apart from normal voice, any abnormality is there in their voice. So, say like harshness is there, hoarseness is there, the voice is breathy. So, in that, how it is affecting an individual and what kind of non-medical treatment can be done for that. So, that's where we guide them for the voice therapy.
So, it's possible at any age to recorrect, because there's so much of need for singers, people have the passion. But then they can look at this kind of a support from your side. Does it work well at any age?
Yes.
So people can look forward to the singers. You don't need an auto tune.
See, if like it's an individual quality as well. But if you are singers, and I mean, I always feel that if to have a good voice is good, but you need to maintain so that voice. So that's where we voice therapists help them how they can maintain their voice with their routine life.
Okay. So you give them guidelines.
Sometimes voice artists, they don't take care of their voice very well. So clinically, how need to maintain the voice, we help them to understand and guide them.
So it's very helpful for people who are in this particular profession who want to get a better voice. It's all possible.
Yes.
So that's good. I mean, that's something which people probably wouldn't know of.
Yes.
So one more thing, referring to what you said earlier, is people with stammering problems. Does it also can be corrected?
Yes. Many people have a misconception that stammering cannot be treated if it is hereditary. It's not. In a way, stammering is something like irregular habit. So what happens is most of the children who start learning language when they start learning language within 0 to 5 years, many of children have some little primary hesitancy to talk. Say if you are having English language at home and then you are learning also Hindi, Marathi, and you are not sure about those sounds or words which are spoken in that language, then many a time children develop that hesitancy. And if that hesitancy it is noticed by others and it becomes sensitive for that child, then child keeps on forming that wrong habit. The moment I'm going to speak, these people are going to be worried about me. Or the moment I'm going to speak, they are going to make corrections for me. So sometimes they speak little faster and then say the words. So it's like start developing that abnormalities and then it becomes a habit.
Okay, so this happens through a period of time.
Yes. So if it is corrected earlier, does not fall into habit, and the stammering can be reduced. But once it becomes habit for an individual, we have a lot of vices and to correct it takes a lot of time. The same way, the way you talk, that habit you develop, to break that habit and form a new habit becomes a little difficult.
That's when you'll come into the picture.
Yes.
And what should parents do to probably not get into this line? As you said, this basically we in India speak many languages. And at home, it's English.
So there are many factors. One is that when you, like nowadays, every parent have 1 or 2 children. So the whole concentration goes into their child. And when they start speaking, if they speak little differently, the parents get worried. Why my child is speaking like this? Or they start giving attention, and if the child is speaking in a baby language, they encourage that baby language also.
This is so sweet.
Yeah, so sweet, baby language. And then they make attempts in front of others also, tell my child, how you speak. So now all those parameters, like what is happening is when the child is born, he is learning a language from his environment or her environment. So if that environment is not giving a correct model, and that also become, wrong habits. Child also like feels that, whatever baby language I'm using,
Right.
my parents are comfortable with that, and I'm getting attention from the child, and they continue that.
That affects when you grow up.
Yes. So as a parent, you need to give them a correct model to speak.
So if the child has come to that place, can it still be corrected? Until what age can the correction can be easy?
The correction, if it is physiologically, physically not affected, then can be corrected at any age.
When you say about physiologically, physically, what do you mean by that?
So if, say, if the child has tongue tie, okay, tongue is not reaching to articulate those sounds which is done with the tongue. Of course, that correction is not possible. So first you need to correct that tongue tie and then work on the speech therapy. That is like an example of physical. And if it is physiological, means the child has developed like something like stammering, where the child is talking first and then taking a breath later. So he has to stop to take a breath. So in our speech pathology, it says that breathing and speaking should go simultaneously. So if that is affected, continuously the child has a difficulty to talk. The fluency gets affected. So that's where we speech pathologists help them to correct the physiology. But then the physiological habits have become so much to break and form a new habit. Takes a lot of time, and then for that you need to have patience, you need to work on it, which generally people nowadays, youngsters and all, they don't have patience to work for it. So it's literally you need to put a lot of efforts to correct and move ahead.
So you'll incorporate some breathing techniques also into
Yes, we give a lot of different kinds of exercises to correct the stammering.
Okay, so as a person, that who was going through that kind of concern has to keep doing it to get corrected, and correction is possible.
Yes, I feel that stammering is like a onion.
Okay.
Onion has a root which has a fear.
Okay.
Once you have that fear of talking, you feel guilty about it, whenever you have to speak. So you form another layer of guilt. And then if you are suddenly given a chance to speak and you are not prepared for it, you feel frustrated.
Right.
And that frustration reaches to more fear. So rather than you are coming out of the fear, you are forming more layers of fear. So if any individual has a stammering problem, the root cause is fear, which we need to remove first.
And you have methods to do that?
Yes.
That's another topic and probably a longer one. But definitely the people can reach out to you where they can do solve this problem. There's a lot of possibility that can be done. Yeah. People can reset their life by getting, because today we need to talk and converse with people all the time. And there is a way of resetting our entire mode, right? So it's sort of physiologically and use those words. So it's a body-mind connection, which
So physical, physiological, and psychological. Okay. All three areas needs to be corrected in a right manner, understanding that an individual. Like I had one of my stammering patient, and then once I finished doing therapy with him, and I told him to attend the public speaking classes. And I was so fortunate that the person who was running public speaking classes, he invited me to judge his batch, how these people are doing after learning public speaking classes. And I was like, when I went there, I was so surprised to see my patient participating in it, and compared to all other students, he was the best.
Okay.
Because he learned the correct method of speaking.
Okay. So definitely a lot of hope for people who have concerns like what you're talking about. Wonderful. How did you get into this field, and your younger days in life, what inspired you to get into this field?
I came into this field by fluke.
By fluke? Tell me about it.
I actually wanted to do I wanted to become general surgeon. Okay. And I wanted to go into medical field. when I passed out my 12th, that time there was a strike of teachers. So our results came very late.
Okay.
And there were like admissions going on a little late, and I did not get into medical. So, and my parents were also not there, and I was not sure that if I don't get into medical in Bombay, where do I go? Even I applied out of Bombay. I got it in one place where there's just private medical college had started, but the fees were very high. That's fine, but my parents, I never wanted to leave them and go. So then I had to select some course which is related to medical. I had applied for physiotherapy, occupation therapy, and audiology and speech language pathology, and many other like homeopathic, other medical courses. I went to give the interview for occupation therapy, but somehow like it did not fascinated me. And when I went for interview, the sir said that there's one seat vacant in audiology and speech language pathology.
Okay.
Do you want to go for it? I was not aware about this profession at all, but something related to specially able children and something related where some unique parameters can be worked out. So I said in the interview, yes, I am okay with it. And after 4 days, I got into that. So I was not aware about what is audiology and speech language pathology, but just because I wanted to work in medical field and wanted to be with my parents, I selected this line. And today, like, I'm really enjoying it.
You're happy about it. And, but I think the country still doesn't know much about this, right?
Yeah, so when I passed out, all over India, only 65 seats were available for audiology and speech language pathology. And today, I think 4,500 seats are there.
This was about 20-25 years back?
32 years back.
Okay, been there and done it and you know it. So you are a name to be reckoned at this part of time. With audiology and speech therapy, what is the kind of fulfillment you get when you are helping the less fortunate? Because you are known to do a lot of things for people who are in that economic strata of life, no? So how do you get the fulfillment and joy?
So basically, when I started working as audiologist and speech language pathologist, I finished my graduation. I joined Dr. Gandhi, ENT surgeon, and I joined one of the institute where they were working for the hearing impaired children. And of course, with Dr. Gandhi, I learned a lot of medical part of how to deal with these children. And when I worked with them for over 2 years, and I found that, if I help these hearing impaired children, and that time in 1998, digital technology for the children for hearing impairment came into market. And I felt that if the children is given hearing aid to their requirement, and the digital technology like how you're using in the phone, TV and all, it is helping them to overcome their challenges. So that's how I started working with them, and I trained many hearing impaired children, and I could mainstream them in the normal society. So then I thought that if I have this potential and skills, why not I work further for the hearing impaired children? And that's how with Dr. Gandhi I started Josh Foundation in 2004, and it's like last 20 years I've been working with underprivileged hearing impaired children. And through Josh Foundation, we have helped more than 1,800 underprivileged children. And today, 25% of the children we have mainstream in the normal education system.
Tell me a little more about Josh Foundation.
So, in 2004, I went to Denmark for a conference, and there the neonatal screening, the baby who leave the hospital, for all the children they started doing. So around 80 countries follow their protocols. All the children who leave the hospital, they are screened for hearing. So when I came back, I spoke to Dr. Gandhi that they have initiated doing hearing screening, and we are not aware about it. Still, the age of detection of hearing in our country is 7 to 8 years. people are not.
They don't realize about it.
Yes. So we should do something about it. I had got that OA screener with me in 2004.
What is it?
That is called autoacoustic emission test. So when the child is born, if the ears are clean, within 24 hours, you put the tube into ears and it shows pass or refer. Pass means the child hearing is normal. And if refer means you have to test the child after 3 months again, 6 months again. And still if you continue getting refer, means the child may have a hearing loss, then you need to do a detailed testing. So like how you do screening of your eyes and other thing, the same way the hearing test has to be done. So we started meeting pediatrician, gynecologist around way back in 2004. And the response was not so good. And they were saying that it is not coming, compulsory for the government. And if in case, if we do the test and we find out that the child has a hearing problem, they will say it is a delivery problem. So then I thought that if I am not able to gain, enough information from a gynecologist and pediatrician, let me start educating the laymen. And that's where Dr. Gandhi and me decided to start a Josh Foundation. We started conducting events for them. So, and we get the children who are coming from the special schools of hearing impaired and the children whom we have treated, and integrated into normal education system on the same platform. And they realize that, the children having the similar hearing loss but doing good with the digital technology. Okay. And those who are studying underprivileged in the special schools, they are not doing well. So the parents started become curious, that child has a similar hearing loss but still doing so well. Why our children can't do? So that's why we started creating awareness among them that the children, like I have not seen in my 32 years of practice, any children having no hearing. They have 5%, 10%, 20% hearing. And if we give them hearing aid to their requirement and best technology where outside noise is not affected and only speech is recognized through the hearing aids, then they hear well and they speak well.
Okay. So when you say 5%, that can be corrected to?
Up to 90-95%.
So 5% can go to 90-95%.
Yes.
And this awareness has to be there through the country.
Yes. So we have around 6.3% population which are hearing impaired.
That's a large number.
Yes. Out of that, 60% are adults and 40% are children. And out of that, 40% of the children, only 10% are getting a proper treatment. So there is a huge work to do in this area.
How that can be done?
So any child, those audience who are listening us, any child you come across having hearing problems. So one is that you should find out that how good hearing they have, maybe 5%, 10%. And then they should be given a hearing aids which is digitalized, which reduces outside noise and give more speech and done to an individual's requirement. So like if I have a 5% of hearing and if I get a hearing aid which is for a person who has a 50% hearing loss, I'm not going to benefit it. Or if I have a hearing 50% and if I have a hearing very loud, then also I'm not going to hear. So under amplification and over amplification, both is not going to work.
So there are people with condition where it's over amplified also?
Yes.
Okay.
So we need to fit the hearing aid to an individual's requirement and then help them to rehabilitate. Now sometimes what happens is misconception is that, we speak to, the moment we see the deaf child, we speak in 1 or 2 words. But actually, even a newborn baby doesn't learn to speak immediately. They take 9 months, 10 months to start speaking because they learn language from the environment, they understand and then they try to speak. So those children who are fitted hearing aid to their individual's requirement, that's where their birth of hearing has taken place. So from that time, people around them should give enough language stimulation to them so that they can understand and they start speaking. So there is a whole process. One, you detect the hearing as early as possible. Within 0 to 6 months, if you detect and fit the hearing aid or do a cochlear implant surgery for them, then within 2 years, they start developing like a normal people, like, hearing.
Without any hearing aid?
With the hearing aid or with the cochlear implant surgery.
Okay. So, the surgery which you're talking about is some kind of an insert you do inside this?
Yeah, so the cochlea, they do a different test and find out that cochlea can be replaced or not. And then once it is possible, they do the cochlear implant surgery and then they activate, stimulation in the brain to hear.
Mm-hmm.
So this should be done as early as possible, then you get the best results.
See, today it's called, they don't call them deaf. People like to politically correct, they say they call them mute or something. That's a word which they coined recently.
But that's not true because they are deaf and they are not hearing your language and speech. That's why they are not able to speak. That's why they are mute. But actually, no more mute word is there. It's just only deaf, and that can be created also like correction, hearing impairment.
Give me an example, probably one incident or one of the patients whom you have kind of seen a change and they are fitted completely into normal society.
So recently only there is this one boy who came from Udaipur. He has around 80% hearing loss.
Okay.
And then sometime when he was 7 or 8 years old, I had visited Nathora temple and his father was talking to me that his child has a hearing problem and they are not able to help him to learn the language and he's really finding difficult to listen to people. And I told them that why not you come to Bombay and I will help this child. So he was wearing the behind the ear hearing aids analog where outside sound is too much. He was not understanding the speech. So they came to me and I fitted hearing aid to his requirement. Then he started learning language. He was integrated into the normal education system. And then later on again after 5 to 7 years, he needed another hearing aids because they didn't work further. So I gave another hearing aid. And today I'm so happy that that boy has finished his BA in arts and he did MA in Sanskrit.
Okay, and he can speak Sanskrit?
Yeah, Sanskrit, and he can speak like how we both are talking to each other.
And you can't even figure out that.
Yeah, he has a hearing impairment.
That's amazing. There will be many more examples like that.
Yeah, like that. So many, like I must have fitted hearing aid to around 5,000 to around 10,000 children. And out of that, so many have become engineers, social entrepreneur. There's one boy who is a PhD. So many engineers are there, interior designer, and doing so well. And I feel so blessed that, I got to work with them.
That's so nice. And so, which part of the day in your life you feel that, look forward? Okay, today the day starts with something which, because you're helping people every day. What's the part of the day which you're looking forward to always?
First of all, I enjoy my work. And being an audiologist and speech language pathologist, I feel that people have come to me, having difficulty in their mind, and especially parents becomes they have so much anxiety that, my child has a hearing impairment and then how I will work with it and how I will overcome this. And I always tell them that rather than finding out how much hearing loss your child has, find out how much hearing your child has.
How much?
Rather than finding out how much hearing loss, you find out how much hearing your child has.
Okay.
So if you have 10%, 20%, so we have a technology which can correct it up to 85 to 90%. Being in medical field, you always feel that, people are coming to you when they have difficulty. And as a medical practitioner, you have promised to yourself that you will give a right path to the people who are coming to you. So every day, many parents of specially able children, children having a difficulty and coping up with the education, they come to us, and it is our duty to guide them. And especially when I see the specially able children and their parents, they are literally struggling to work with them. I always tell my husband that, we are lucky to have a normal children, but we should see the people who have a specially able children and, working hard to overcome the challenges of their children. And I always feel motivated because they know what they have to do for their children. So every day I get motivated by parents who especially working with the hearing specially able children, and also from the specially able children because they need to communicate with the normal society people. They have to struggle from the time they have taken birth. And during Corona, for small thing, we used to get panic. And I used to teach online therapy was for this hearing impaired children, and they were literally struggling, to communicate. I felt that we as a normal people get panicked by such small thing, and these children, fighting every day to overcome the challenges. So I feel when I work with them, I get so much positive energy from them. So every day it's like adding energy in my work pattern. So every day I look forward rather to work with them. I enjoy my profession.
That's how it makes it better.
Yes.
So, two questions right now. One is India's bigwig in the medical, the kind of medical bigwig in the audiology part of it. How is it going to improve further? And when you started off, the things which have changed from then to now, how has it been? It's been a sea change and it's improving, right?
Yes, but still a lot of improvement need to be done. So first of all, as I told you that neonatal screening started way back in 2004 in many countries, and it's almost pediatric protocols are available in the 80 countries, but still our India is not there. We have not yet made neonatal screening compulsory in our country. So there, one big change need to be done, that every child who leaves the hospital should be screened for the hearing. Second, people are still having the misconception about, how the hearing aid works. Of course, digital technology came into market from 1998. It's almost now more than 25 years, but still people are accepting the technology change in phones, electronic media, and a lot of electronic gadgets, but still are not ready to accept the technology change to work with this hearing impaired children. So technology needs to be utilized for these children and in a right manner. That change we need. Apart from that, government sector, there are only 3% seats are available for the specially able children in the normal education system. Hearing disability, especially invisible, ability. So people are not seeing and not working for the hearing disability. So of course there is need to be change from the government, from the education system, so that they can also be mainstream. And hearing disability is only disability which can be reduced from the society, because they don't have any other issues apart from hearing. So if the hearing is given, they can lead a normal life like us. So we can reduce the liability from the countries and can make them a national assets.
Okay.
So there are a lot of changes needs to be done, and even working with other specially able children, like from childhood you take a good care, find out and give a right diagnosis, do a best rehabilitation, then they can also use their best potential and overcome a lot of challenges. So there are still a lot of misconception, non-acceptability of doing something still is there. Of course, when I started in 1991 and today, there is a difference. Okay. But you cannot say all of that.
More to be done.
More to be done, yes.
What are the things you should tell right now to the government at this point of time in the center? What should be done?
So government should specially make a committee who works for the hearing disabled children.
6.5% in the country.
6.3%.
3%.
Yes.
There's a large number.
Yes. There needs to be a proper taken care by pediatrician, gynecologist, ENT, and all other medical practitioners who are involved in working with the specially able children. There has to be a teamwork that should be guided by the government. Plus, every individual should be given hearing aid to the requirement rather than giving in a mass where they don't benefit. I mean, if you see a simple example that there are 450 special schools in the country and around average 250 children.
Okay.
And say if they are giving a standardized hearing aid 5,000 to children, then if you count altogether calculation of 56 crores, which
There's
is
a kind of funds required.
which goes in waste.
But is that money given? What do you mean to say?
I'm not saying, I'm just giving a general example that if this is the way done and if the children are not benefiting from the hearing, it's a waste of money. It has to be given to an individual's requirement because every person's hearing is different.
Okay. So, talking on this point, your association with CGHH, which is there, can you tell me more about it and what happens beyond the public eye?
So first of all, I've been very lucky that American Academy of Audiology, who is the biggest organization in the world for the audiologists, they have honored me with the humanitarian work which I have done in India.
Okay.
I received a humanitarian award in 2012 from American Academy of Audiology, and since then I have started creating a lot of awareness nationally and internationally. And because of creating so much awareness among the people and the society, Coalition of Global Hearing Health is a international organization. They have designated hearing health advocate for all the countries. So I've been I've been selected for here India. So I'm a hearing health advocate for CGHH for India, which is supported by WHO. And also WHO has started World Hearing Forum, where they have invited a lot of organizations to work together to create awareness for hearing health management all over the world. So our George Foundation is part of World Hearing Forum, and they also have made groups where they work on World Hearing Day, which is celebrated on 3rd March every year. They also have a committee which creates a World Hearing Report, and they also publish about the change makers, means those hearing impaired people who have worked hard and overcome their challenges. And also WHO feels that by 2030, 1.1 billion youngsters will be affected by hearing loss because they are using continuously the headphones and musics and all. So they have made the committee called Make Listening Safe. So I run the social media part of Make Listening Safe to create awareness among the youngsters.
That's nice. When you're talking about hearing loss, particularly because of certain reasons, there was a case of Alka Yagnik ji which happened. Can you tell me a little bit about it? What happened?
So as I told you earlier that if there is any viral infection which happens in your ear, you lose temporary hearing. And you need to consult the doctor immediately, because if there is a treatment given immediately within 48 hours, then you can reverse your hearing. But if it is delayed, then the reversible hearing loss is not possible. So whenever you come across that you have any hearing difficulty, it is your duty to go and consult a doctor and find out, because hearing is very important for communication.
So what happened to her?
So she got a viral infection in the ear.
That's how it affected her.
Yes.
And that can happen at any age.
Yes.
Precautions?
Precautions is like at any age, if you take care of your hearing and you monitor your hearing is very, very important. I mean, any individual who has hearing issues and feel that, they are not able to communicate as any other normal person is communicate, they should consult ENT or audiologist.
And they might not realize it.
Yes, the importance of it.
In between the podcast, I say Jai Shri Krishna.
Yes.
Because the love of Krishna Bhagwan is being there. It's more like a childlike feel for them. Tell me about it. What is that really that enamored about Krishna Bhagwan?
So basically, I'm born in Vaishnava Dharma, so we follow Lord Krishna. And my parents, my mother especially, is a very big devotee of Lord Krishna. So it is there in us, to pray for Lord Krishna. And as I told you that especially when in Corona, I saw these specially able children, struggling, to communicate with people. They were very vast. The hearing impaired children were not able to, see or lip reading. They used to literally concentrate, to communicate with people. So as Lord Krishna also says that, kindness will only create the beauty in the world. So as a follower of Lord Krishna, I feel that, God has sent me with some purpose. And I am here to change the lives of people. So I just follow him. I read a lot of books on Lord Krishna, his Leela, and read and try to follow in my life that how he has taken every birth carnation to help people. Of course, he is Lord Krishna, but even if we follow one person out of that and help to change the lives of people, it's a great thing. So I feel purpose of being on this universe given by Lord Krishna, and I should work hard for it so that he knows that I have done something in life.
What is the one teaching of Lord Krishna you feel which is going to apply in a modern life?
I remember the conversation of Lord Krishna to Arjuna when he was fighting with his own family members.
Mm-hmm.
And Lord Krishna says that you have to fight with them because you're fighting for the truth. You're fighting for people around you who need a clear picture of Dharma. So today, I'm working with hearing impaired children. There are a lot of misconceptions, and I know that I have that potential to change the life of this 6.3% population of India and 430 billion people of the world. So why not I make that effort and try to change them?
Wonderful. That's such a beautiful thought. What future endeavors do you have? What is that you are looking forward to?
So working with hearing impaired children and getting inspiration, I have started writing articles on spreading positivity. Since last 4 years, I have written more than 225 articles in English and in Gujarati and Hindi. Mm-hmm. I feel that writing this spreading positivity articles, I will spread the happiness in the world. And of course, working with hearing impaired children, I will see that whatever best potential I have, I will try to reach to all the children of India and of course internationally, and see my best that I create beauty of kindness in the world.
That's so nice. So one last thing, as a society, how do you think we can do better in terms of creating a safe and environment where hearing or speech disabilities can be handled in the best possible way?
In society, first of all, we should understand that communication is very, very important. Okay. And for best communication, you need to have good hearing, best understanding and expressing your own self. Okay. We need to see that if the children who are specially challenged, whether they are hearing impaired or any other especially able children, we should find out the correct diagnosis for them and then work on all the areas so that they can enhance their potential. So if I'm working with a hearing impaired child, then find out hearing as early as possible, give them best digital hearing aid, give them a good rehabilitation so they can be integrated into the normal schools. Apart from any normal children having any speech and hearing issues can be corrected as early as possible, because 0 to 5 years is the best age where the child's brain is flexible. And it is said that 0 to 5 years, if you give the good stimulation to the child, then they can learn more than 300 million words and 20 languages.
Okay.
So,
that what span can
0 to 5 years.
And within that span they can learn that many languages.
Yes. If you give them a correct stimulation, doesn't matter which economical background they are coming from.
Okay. And how can that be done?
By parents and teachers who are working with the children, talking to them.
Okay.
And that can be done with the specially able children also. So the more stimulation is given, you can reduce the disability. And of course, teach them spirituality, because it is also equally important.
It's more needed.
Yes. Our country especially has so much cultural values and so much strength, which we can pass it on to the world. But we are not paying attention to that.
Right.
We are so conscious whether our children will grow properly or not, whether our children are speaking properly or not, whether they are going to a good school or not, good education system or not. But we are forgetting that we are not providing the right cultural values to them.
It should be inculcated from school, it should be brought up. You bring so much of hope to people.
Yes.
And those who are hearing us, listening to us, this is going to make a lot of change in your life. So, Devangi ji, thank you so much for being on the show. You gave us so many snippets, so many details, and this brings in a lot of hope. Thank you so much for being on the show.
Thank you very much for inviting me. And any parents who feel that they want to work best for their child, please, if you have any difficulty, come and do meet us. We will try to help you as much as
we're going to put details on our link on YouTube, and that will definitely be connected from there on.
And I request especially mothers to work with their children, because they are the future of our country. So the more the cultural values and the peace you will bring in the children, they bring peace more into the world.
You're going to add much more hope to the world, and that's so nice. And we'll take that point of spirituality which has to be added in everybody's life.
Yes.
Thank you.
Thank you for inviting me.
Pleasure.